Let's continue with diagnosis according to Zhang for organ patterns. And for today, we'll discuss phlegm fluids blocking the lung. The difference between this pattern and the previous phlegm patterns is that here phlegm is very watery, not thick as in the previous one. This pattern often has its root in the condition of yang deficiency. Its etiology can be traced to old age and long-term physical overexertion. The ingestion of cold and phlegm-creating foods can also lead to the formation of this pattern. Repeated invasions of wind, cold, and damp can also be contributing factors. What are its signs and symptoms? Here we have cough with thin, watery, frothy sputum, wheezing, shortness of breath, superficial breathing, vomiting of white foamy mucus, aversion to cold, a fuzzy sensation in the head. There is also chest oppression, dizziness, lack of thirst, a scanty but pale urine. The patient feels suffocated if they lie on their back and must sit upright in the bed. There is bright white complexion, wet and white tongue coating, and a slippery, wiry, or soggy pulse. The key symptoms here are cough with watery sputum, cannot lie flat on their back, and there is also chest oppression. For the treatment principle, we drain phlegm fluids from the lung, regulate lung qi, and tonify the yang. In acupuncture treatment, we can choose from lung 5, lung 9, REN 9, REN 12, REN 17, UB13, UB23, UB43, PD7, stomach 36, stomach 40, spleen 3, and spleen 9. For the needle technique, we can use a tonifying technique. Moxa is also recommended except on lung 5, stomach 40, spleen 9, and REN 9, which should be drained. As an explanation to the choice of points, lung 9, UB13, and 43 tonify lung qi and transform phlegm. Lung 5 drains phlegm from the lung and regulates lung qi. REN 9, spleen 9, and stomach 40 drains phlegm and fluids. REN 17 regulates lung qi. REN 12, stomach 36, and spleen 3 tonify spleen yang and transform phlegm and fluids. Kidney 7 and UB23 tonify kidney yang and transform fluids. Here's a relevant advice. The advice previously for damp phlegm is also relevant here. The person should also try to strengthen their yang qi. They can do this by consuming foods that are warm and avoiding cooling foods and cooling of the body in general. Phlegm fluids blocking the lung can be caused by the following patterns of imbalance: lung yang deficiency, spleen yang deficiency, kidney yang deficiency, and an invasion of wind, cold, and damp. In turn, this pattern can result in lung yang deficiency, spleen yang deficiency, kidney yang deficiency with water overflowing to the heart. Thank you for listening.